I'm Dr. Joanne Stone, co-author of Pregnancy for Dummies. Just because you're pregnant does not mean that your sex life needs to end, but there are some things that you should know about sex during pregnancy.
I'm Dr. Keith Edelman, co-author of the Pregnancy Bible. Many women have told me that orgasm is more intense during pregnancy, and for that reason they find sexual activity more desirable.
I'm Cara Natterson, author of Dangerous or Safe. Just because you can have sex doesn't mean you want to have sex.
Is it okay to have sex during pregnancy, or will it hurt my baby?
A lot of women ask me whether it's okay to continue to have sex during pregnancy, and the answer is, of course, it's fine. There's a concern that a lot of women have, and even their husbands, that somehow having sex is going to hurt the baby. There's a worry that during intercourse the impact of the penis against the cervix somehow can cause some damage, and that really can't happen.
Some people ask about lying on top of the mother. Is lying on top of the mother injurious to the baby? Well, actually it's not, because the baby is surrounded by amniotic fluid, which cushions the baby. Now sometimes later on in pregnancy, lying on top of a woman is just uncomfortable just because of the sheer size of the uterus. It's not going to harm the baby itself.
There actually are some times when we think it's probably not a good idea. One example of that is in a patient who's having bleeding. Sometimes bleeding can be from a placenta that's really low down, and actually having sex can cause more bleeding. So if you're diagnosed with either a placenta that's low-lying or is covering the cervix and it's the latter part of the pregnancy, it might be best to avoid having intercourse.
If the cervix is significantly dilated, then having sex can actually introduce infection into the womb. So that might be another situation where you should avoid intercourse.
Patients who are at a higher risk for preterm labor might be better off avoiding sex. And I'm not talking about just with a prior history of a preterm labor, but I'm talking about current preterm labor. So if you've been diagnosed with premature labor, most doctors will tell you to avoid intercourse.
If you're having bleeding or pain or you have any physical concerns, you should call your obstetrician. I promise your obstetrician is looking out for the health of you as the pregnant mom, but also your obstetrician is looking out for the health of the fetus that's growing inside.
Even in these situations when sex should be avoided during pregnancy, couples can often find ways to mutually satisfy each other. Sometimes just cuddling, or there are other ways to find sexual stimulation.
One thing that a lot of women don't feel so comfortable talking about is how pregnancy can change their sexual desire. Now, some women find that it actually heightens their desire. A lot of women find that intercourse is more enjoyable, or they're more likely to reach orgasm, or orgasm is even better.
Orgasms sometimes are quite more intense during pregnancy than they are when you're not pregnant. And they can cause an occasional contraction, but they're not going to cause the type of contractions that can actually injure the baby or cause harm to the pregnancy. Other women have told me that since there's no fear of becoming pregnant, because they're already pregnant, that they find sex a little bit more fun and they're not worrying about becoming pregnant.
Some men find the pregnant body absolutely beautiful, and they find it to be a real turn-on. However, some men have similar fears to women, that they're worried that somehow intercourse is going to hurt the baby, and that really can affect their sexual desire. On the other hand, some women actually find that they have less of a desire to have sex. Sometimes that relates to body image, and sometimes people don't feel so comfortable in their changing body.
Later on, though, in pregnancy, men can become very, very concerned about their ability to take care of the child once it's born. And sometimes this anxiety can lead to a decrease in sexual desire.
Just because you can have sex doesn't mean you want to have sex. My patients have other kids, right? I'm a pediatrician, so people who come to me already have 1 or 2 or 3 or 4 other kids at home. When they've got kids running around and they're pregnant, they're even more exhausted. So I often hear in my office, do I really have to?
The real key is that it's really different for everybody. That some couples find their sex life is fantastic and even better during pregnancy. Other people find they're not so comfortable with it.
No matter what your anxiety or concern is about, talk to your partner about it. And if the two of you communicate openly, then it's going to be the most rewarding experience for both of you.
Have a question? Ask the experts at parentsask.com, because raising kids raises questions.